So, hi everyone, my name is Dr. Caroline Taylor Walker and I am talking from the car, which is probably quite apt with Heroes Home Doctor. Now, every month we're going to do a bit of a webinar with you to try and give you some education and guide you through some things that might be happening through the year as well. So today we're going to talk a little bit about Asthma First Aid. This is something that we obviously should all be really aware of. There's lots and lots of people around in the community and people that you might come across within your time that suffer with asthma, and I think it's really important that you know how to deal with them if they have an asthma attack right in front of you, because dealing with it correctly could be absolutely save their life. So I just wanted to let you know as well that I am recording this on Zoom at the same time, so if I look around it's because I've got two things on the go. So basically, as most of you are probably aware, asthma is an inflammatory condition of the airways. It can be common in any age group, but is particularly common in children, but can obviously progress until adulthood. Now, it is triggered by a number of things. It can be an allergic reaction, so people can have allergies to things like pollen or pet hair. House dust mite is a really common one. Also different grasses. So often with the allergy, they obviously have to come in contact with the allergy. But you could find in children, this is something that they come across quite regularly, especially if they might be a friend visiting at your house. You might have an allergy to a cat that you weren't aware of. Asthma can also be induced to have an asthma attack with things like exercise. So again, if you've got a child running around, maybe at a sports centre, it's something that could happen. It then can in adulthood be more induced by workplace relationships, things in the workplace air. But it can also be things in the environment such as smoke. So it's something that you do have to be aware of. Most of the time, people with asthma, they look very well. They run around normally. You might not tell that they can have asthma at all. And the actual problem is then triggered by one of these allergens or something in the air that they come in contact with. So most people just avoid these allergens, or if they do struggle with them, they use something called inhalers. Now, there's two types of inhalers that exist. The first inhaler is the commonest one. I'm in the car here, is this blue one. Now this one is known as a salbutamol, which is a drug name, but the brand name is Ventolin or Asthma. This is an asthma one. Now, a lot of people carry these around because this is known as the reliever. This is the inhaler that if you're struggling with asthma that you need to use to get on top of the symptoms. Other people then might have other inhalers that they use on a regular basis. It might be once a day or twice a day that they use to prevent them getting an asthma attack. So we have both the preventers and the relievers. Now, everyone with asthma should carry one of these because these are the things that they need to use if they get into trouble. But sometimes they don't. But hopefully if you're around at a school or if you're around at a sports centre, one of these will be available. Now, with these in hand, with their relievers or their preventers, most people with asthma don't have symptoms and can run around normally. But what we're trying to do is if they have a flare-up, you're able to control the flare-up. Now, if somebody has an asthma attack, the symptoms to start to look out for are those with their breathing. So they might suddenly complain that they're feeling that their chest is tight. They might start coughing more. You might be able to hear a wheeze, or they complain of shortness of breath. So the things that you commonly see yourself are the coughing. The coughing's often the first sign, and then the wheezing, and the person saying that their chest is tight and their shortness of breath. Now, most people would know that if they pick up their blue inhaler and they take some puffs, they can deal with it themselves. When it becomes an emergency is when you see that when they're using their blue inhaler, their symptoms aren't getting any better, but in fact, the symptoms are getting worse. And if they're ever at the stage where they're struggling to actually talk because they're so short of breath, or you're seeing that their lips are turning blue, then that turns it into an asthma and emergency. Now, the first thing to do if there's a couple of you around is send someone off to call an ambulance straight away. So call 000 instantly because it does become an emergency. It can be quite difficult to get on top of the asthma then. The next thing is to try and find a blue inhaler. The ideal is to try and find the patient's one, but if they haven't got theirs at hand, just get the blue inhaler from anywhere. But then the thing to then remember is the rule of fours. So basically what we try and get the patient to do is take 4 puffs of the blue inhaler every 4 minutes. So in reality, what I want you to do is send someone off to get an ambulance and someone to try and find a blue inhaler. You then want to sit the patient down and really really calm them down and keep the situation as relaxed as possible. Anxiety can increase and exacerbate the asthma and cause the breathing to get worse. So you want to have them sitting upright, nice and calm the situation, talk to them gently, try and talk them through their breathing and reduce that anxiety to try and get control of their breathing. Then you want to get the inhaler, give it a good shake. You can then take the blue bit off the end. Now, the ideal is to use a spacer. Now, unfortunately, as I said, I'm running a bit behind today and trying to squeeze this in on time, so I didn't get the time to pick up my spacer. But the spacer is a plastic device that looks like a cone, like a cylinder, I suppose. It's pretty simple to use. One end, there's a little hole for this to go in, and at the other end, there's a mouthpiece similar to this shape, which goes into the patient's mouth. Either way, you give this a shake and you simply press the top. So if I press the top now, you'll see and potentially hear some of the medication come out. So what you want to do is give this to the patient, preferably through their inhaler. So in the inhaler, you give the puff, and then you ask the patient to, you watch the patient take 4 breaths. So it's 1 puff, and then they take 4 breaths. You then repeat that 4 times. So you do 4 puffs of the inhaler. 1 puff, 4 breaths. 1 puff, 4 breaths. 1 puff, 4 breaths, and number 4, 4 breaths. So again, remember that rule of 4s. After that, you wait 4 minutes. So what you want to do during that 4 minutes is start assessing their breathing. Make sure, again, you're keeping the situation nice and controlled. You're really calm. Everything around you is really calm. You reassure the patient. You keep them sitting upright and just really keep them comfortable. If you didn't have anyone else with you at this time, we want you to go and call an ambulance or call AAA and make sure somebody can come as soon as possible and give you a hand. After 4 minutes, if the patient hasn't got any better, then you repeat the process. So 4 puffs of the blue inhaler, and then you wait 4 minutes, and you basically keep repeating that until the patient actually gets better or until the ambulance arrives. So 4 puffs every 4 minutes. If they haven't got a spacer, then hopefully the patient's able to use the inhaler, but it is quite difficult for them to use it if they're struggling with their breathing. The way they do it, and they should know, is that they take a deep breath in, you put the inhaler in their, they take a deep breath out, you put the inhaler in their mouth, and as they breathe in, you press the button. So then the aim is that as they breathe in, they suck out the powder that's coming out of this. So again, you do 1 puff, get them to inhale in, take in that medication, and repeat that 4 times. Now this is a good kind of method to take, but obviously if they're an adult, you can actually give them up to 6 to 10 puffs in one go. So if they are really struggling as an adult, do increase this. Now, there are other things that you can do with other inhalers, but most people only have these. If they've got another inhaler, such as a Bricanol inhaler or a Symbicort inhaler, you can use that instead. But instead of using 4 puffs, you would use 2 puffs. But to be honest, in the long run, and if it's an emergency, you can't overdose on these, so just give them. So the most important thing is sit them upright, keep them calm, 4 puffs every 4 minutes, and call an ambulance. So I hope that helps. I'm trying to find my lid, but I can't find it. If you have any questions about asthma, about the Asthma First Aid, please don't hesitate to contact us. Also, if you would like to us to talk and give you a webinar or any information on any other problems, then please, again, get in contact with us. These are supposed to be to help you and to educate you and be for you, not for anyone else. So I hope that's made some sense for you. Yeah, please keep in contact and contact us if we can help you in any way. And thank you so much for taking the time to listen. I really appreciate that. And welcome to my car. But I suppose being Hero's Home Doctor, we have to do it in the car for you. All right. Well, I hope you will enjoy your Monday and have a good evening. Thanks for listening.